Well, I think some of the things to consider if you think you want to go into clinical teaching is how does that look at different institutions? I think at this point, it's not one set way that you can do it. And so if you know where you want to be going or what specifically you want to be doing, it's important to talk to the institutions or the places that you're going to work and see what is that going to actually look like. Some places actually have roles for clinical educators, and you might be hired in that capacity where the roles are very, spelled out as far as what you need to do. It may be that you are, involved in fellowship teaching, in residency teaching, in med student teaching, or it may be that if you are in the role of a program director, you're primarily doing fellowship teaching, but there may be somebody else who is in charge of doing, say, the residency or the med school teaching. So I think that it's important to ask those questions when you're looking at a specific institution or place that you're going to work, is where is the need and what capacity will you be able to work in. People largely think of being at an academic institution when they think about being in clinical teaching, because that's where we train our next generation of doctors. However, there are lots of opportunities to be out in the community and be affiliated with an academic center and have lots of learners come through your clinics. And so there are quite a few private practice physicians who have teaching as a large part of their day when they have residents or fellows come through their clinics, and they teach them as they go through their clinic day. And oftentimes we'll provide many of the lectures and teaching seminars for learners. There's not only opportunity to help train fellows and residents in the traditional way that we think about with lectures and spending time with them in clinic, but there are administrative roles that educators can take too, being on graduate medical education committees, which can help develop policy and approaches to learners in your local institution, and also spanning many groups of learners. And so there's opportunities to start at the undergraduate or med student level where you can be involved in teaching, first and second year med students before they get to their clerkships, as far as lecturing on basic pathophysiology and also tying in the clinical component of it, in addition to having the third and fourth years rotate with you through your clinics and really playing a major role in being an educator for them while they're deciding what they ultimately want to go into. Then for endocrinologists, at the residency level, it's important to be involved with many of the internal medicine or family medicine residents who are going to be rotating on your services, because they oftentimes encounter a lot of endocrine issues that we as endocrinologists maybe aren't going to be seeing, but we rely on our primary care physicians to be taking care of. So really, every clinic and every patient encounter is actually an opportunity to teach. If you have that in mind, there's just a wealth of information to not only teach as the teacher role, but also to absorb as the trainee role. Rather than looking at it as work that you have to get done, it's actually looking at every patient encounter as an opportunity to maybe take this aspect of what happened during their patient encounter and say, okay, see how that was different from the last person we saw. And so it doesn't necessarily have to be all of the really unusual cases or zebra type cases are the only things that we learn from. Everyday medical conditions are also great teaching opportunities, because that, quite honestly, is going to be a lot of the stuff that we see once we're out in practice too. And maybe one of the clues to the fact that you like to teach is that you do take that opportunity to say, you know what, this was a really interesting aspect of this case, and I want to tell the rest of the team about it. You might be identifying a feature in yourself that says that you really do like teaching, and maybe that's something that you could incorporate into your career as you go forward. I don't know of any clear-cut characteristics or personality traits that are a prerequisite to be a teacher. And actually, that's probably good, because some teachers speak to some learners and some speak to others. There's no one right way to do it, which is actually the beauty of it. Connecting with your learners is really an important step, and I think at least for me personally, when I see people who I think, boy, they are a fabulous teacher, it's when I can see them take a difficult concept or something that's really hard for many of us to explain and distill it down to what is completely understandable, and then see them make the learners excited about it. And it's fun to see them kind of transform the learning for people who maybe have been struggling in understanding a certain topic, and they can make it clearer. If you think that you want to go into a career that involves clinical teaching, I would encourage you to talk to mentors or teachers that you feel like who have really spoken to you. You ask them how they did it, what path they took, maybe some of the advice that they could have for you, because if they inspired you, then it may be that you can take some of those tips to inspire other people. If you feel like you naturally just love teaching, you might already know how to do that. But as I mentioned before, it is not really one size fits all, and there's a lot of different ways you can look at being a clinical educator or a clinical teacher. And so you really want to be looking at where you think you will be going and talking to that institution or that job about, okay, what will my roles in teaching be? If you have a passion for it, you want to make sure that they know that and see if it will be part of your clinical practice, or will it be part of some of your responsibilities where you officially develop curriculum, write the lectures, give the lectures, kind of organize the group of educators, run a fellowship, run a residency, or will it be something that you just incorporate into your daily life? I think those are big questions, and you want to know what are the expectations and what are your roles before you go into a position. Especially in academic centers, as I mentioned, there are clinical educator tracks, but that's going to involve more than just seeing patients and trying to teach as you come out of the room. That's going to involve more administrative type roles where you may run fellowships or residencies or serve on their GME committees or be involved in educating the medical students or other trainees in the institution. And I think it's important to know what is going to be expected of you, and then how much of your time will be protected and given to do those activities. So those are all really good questions to ask, because there's no one set formula for how this is done. Absolutely. I think that pursuing a career in clinical education can be one of the more rewarding things that you can do. It really is fun to see the next generation of physicians coming up. It keeps you on top of all of the changes in medicine and in the literature, and also helps you kind of shape the next generation of learners. And it's fun to see the light bulb go on and see them really get it, and then become excited about going out into the world and becoming an endocrinologist or a physician themselves. And so I think it's a great opportunity, and it's a great career, and I would encourage anyone who loves to teach to go into it.